Good evening. Welcome to the 2024 Living Legends Celebration. Please give a warm welcome to Academy President Linda Scott.
Good evening, everyone. I'm going to do that again. Good evening, everyone. Thank you very much. I am Linda Scott, President of the American Academy of Nursing. Thank you. On behalf of the Board of Directors, it is my pleasure to extend a warm welcome to you for our Living Legends and annual awards ceremony. Honoring individuals who have made extraordinary contributions to health and healthcare demonstrates the importance of our work as nurses and the value we place on ensuring the patient is at the center of our care. For these awardees and living legends, they have made it their personal mission to change care practices, design innovative models of care delivery, and advocate for policy change at every turn. As a board, it is an exceedingly challenging task to select individuals for these high honors because nurses on every continent are deserving of more recognition for what they have done to advance innovation and progress in the name of public health. The ability to recognize these incredible individuals in such a special way would not be possible without the generous support of our sponsors. Deep appreciation is extended to Cedars-Sinai and the American Nurses Association for their investment in tonight's event. Their generosity allows us to share with the larger community that nursing knowledge is key to improving healthcare systems and achieving health equity. Tonight, we begin by honoring the Academy's 2024 award winners. And it is my privilege to introduce the first awardee of the evening, Dr. Loretta Sweet Jemmott. I am proud to honor her with the Academy's Civitas Award. This award recognizes an individual who exemplifies extraordinary dedication to excellence in promoting quality care. Dr. Jemmott, who currently serves as Vice President of Health and Health Equity in the Office of the President and Professor at Drexel University, College of Nursing and Health Professions, is most deserving of the Civitas recognition. She is one of the nation's foremost health promotion translational researchers in the field of HIV/AIDS prevention, having received over $150 million in federal funding to support her work. Dr. Jemmott possesses an incredible track record of developing evidence-based HIV risk reduction interventions in community and clinical settings. Aimed at increasing safer sex behaviors, her studies have not only demonstrated remarkable success in reducing HIV/STI risk-associated behaviors, but also the incidence of sexually transmitted infections. An outstanding translational researcher, Dr. Jemmott's work has had global impact. She has partnered with community-based organizations, including churches, clinics, barbershops, and schools to transform her NIH-funded evidence-based research outcomes for use in real-world settings. 9 of her evidence-based HIV, STI, and pregnancy prevention curricula have been designated by the Department of Health and Human Services, Office of Adolescent Health, and the Centers for Disease Control and Prevention for national and international dissemination. To date, over 45 states across the country are incorporating them in their schools, clinics, churches, or other community-based agency programs. As a community engagement specialist, Dr. Jemmott focuses her work on the promotion of health and health equity and building sustainable community partners. For example, the Jemmott Community Engagement Model is a qualitative, community-engaged, deep dive approach to determine health concerns and was applied within the 10 West Philadelphia Promise Zone neighborhoods. Dr. Jemmott's health equity and social justice work meets people where they are, giving a voice to the voiceless and hope for the hopeless. In addressing her keynote address at Rutgers University School of Nursing Convocation this year, Dr. Jemmott widely said, "Success requires more than just knowledge. It demands accountability and determination." While her knowledge is evident through the success of her many programs and the implementation of her evidence-based interventions, her determination to improve health and achieve health equity is seen through the lasting partnerships she has built in the communities she serves. Dr. Jemmott, it is indeed my honor to recognize you and your prestigious work.
Thank you, President Scott and the Board of Directors for this amazing award. I am honored to receive this recognition for the work that I've done. My life purpose has been not only to promote the health of vulnerable populations nationally and internationally, but to also partner with them to create opportunities for them to thrive and to strive in this world today and have a better quality of life. Receiving this award tonight is a confirmation that I have honored the significant task that has been given to me. So I want to thank my husband, who is also my research partner and my friend, for his continued love and friendship and support. John Jemmott, he's over there. Raise your hand, honey. You know I'm going to call you out. He's my partner all the way. And to my daughter, Jolie Jemmott, who is working on her PhD at Duke in nursing. Give her a raise your hand, Jolie. And my youngest daughter, Julie Ann Jemmott, who's finishing up her master's degree in public policy and public administration at American University. Raise your hand, girl. And finally, my grandson, I got a grandson, who's 3 years old, Isaiah, who gives me much joy. He's over there, so when you see him, blow him a kiss. You know, but most of all, I want to thank God for his many blessings. I know I stand on many shoulders for my great success. And some of you are in this room tonight. As I look at you, I just want to say thank you. Just thank you. So also, as I look around this room at the amazing sea of greatness of all of you here tonight, I am reminded that nurses are phenomenal leaders who are clinicians, scholars, educators, and policymakers who are dedicated to creating ways to provide the best cutting-edge evidence-based care, who are developing approaches to teach strategies that make our students soar, who are tackling some research problems that are very difficult to answer and who are making it happen, and who are creating policies to promote health of this nation. So I am so honored to be in this sea of all of you. So tonight, I am receiving this amazing award that recognizes me for being committed to doing the work that I do every day, all day long. I give voice to the voiceless and hope to the hopeless. I meet people where they are, and I take them where they want to go. And for that, I am so grateful. Thank you very much.
Thank you, Loretta, for your devotion to promoting healthier outcomes through community-driven care. Next, I am privileged to recognize tonight's recipient of the Academy's Healthcare Leader Award. This award honors an influential national leader dedicated to improving the health of the nation through contributions to organizational excellence. I am pleased to bestow Ramón Lavandero with this year's Healthcare Leader Award. Dr. Lavandero is the Senior Strategic Advisor and Organizational Historian for the American Association of Critical Care Nurses. Yes. In an interview with Dr. Linda Burns Bolton in Nurse Leader over a decade ago, he said, and I quote, "There are so many success stories, especially when a person views the tapestry that is each nurse's career instead of its isolated threads." Please allow me a moment to highlight the threads of Ramón's impressive career. Born and raised in San Juan, Puerto Rico, Mr. Lavandero is a trailblazer for Latino nurses. He was the only nurse selected for the inaugural cohort of the Hispanic Leadership Fellows Program, which was sponsored by the New Jersey Department of Higher Education, Woodrow Wilson Foundation, and the American Council on Education. He then became the first man to graduate with a bachelor's degree from Columbia University School of Nursing, before earning a master's degree in adult education from Columbia University Teacher College and a master's degree in nursing from Yale University School of Nursing. Throughout his career, Mr. Lavandero has focused on acute and critical care, having held clinical, academic, and administrative roles in several U.S. academic healthcare institutions. He has been a co-investigator of 4 national studies about critical care work environments and a study of empowerment and specialty certification for nurses. As the founding director of Sigma's International Leadership Institute, Mr. Lavandero faithfully supported the development of nurse leaders equipped to drive their impact further. In this role, he consulted with nurses and health ministry officials in the United States, Latin America, and the former Soviet Union. For over 2 decades, Mr. Lavandero has served on the American Association of Critical Care Nurses Executive Leadership Team. In his current role, he advises association leaders on a wide range of far-reaching initiatives. He has been charged with establishing the association's historical archives to provide evergreen guidance and insight into improving and innovating healthcare delivery. While his remarkable work has helped transform the profession, particularly with respect to nurses in clinical settings, it is his efforts in developing AACN standards for establishing and sustaining healthy work environments that may have the most long-lasting and far-reaching impact. Not only do the standards lay the foundation for a healthier work environment for nurses, they have rewritten the way the relationship between a healthy work environment and improved patient outcomes would be studied in the future. Ramón, I am proud to recognize you and your impressive leadership.
Bon appetit, everybody. Note to self, have Loretta ghostwrite your thank you. But since I didn't ask her to do that, I'd like to thank Linda, the board of directors, and the Academy for this honor. But you know, when the American Association of Critical Care Nurses issued national standards for healthy work environments, it was a real long shot. Some people might even call it a crapshoot. So much so that instead of issuing them for all healthcare settings and all professions, it issued standards for nurses. But even then, most people figured they were for acute and critical care nurses. And that's the way it was. I did have the privilege of helping to write the standards as well as to help spread the word about them over time. So now fast forward to 20 years later, which is now. The standards are widely known, not only in nursing, but across healthcare. And we now have evidence, long-range evidence, that in work environments where the standards are being implemented, it's a healthier work environment. And that has led to this steady drumbeat now, asking that the standards be reframed for all healthcare workers. And even beyond that, we've had requests now to extend the work that Dory Fontaine and her colleagues have done on healthy work environments in academia. So that's why I believe that this is really the American Association of Critical Care Nurses Award, and I'm honored to accept it on its behalf. Thanks very much.
Thank you, Ramón, for your dedication to the Academy and to the organizations you serve. I am now honored to recognize tonight's first awardee of the Lifetime Legacy Award, Virginia Allen. The Lifetime Legacy Award recognizes extraordinary individuals who have dedicated their life to advocating for positive health system changes. Virginia Allen is an inspiring figure, a nonagenarian who maintains her nursing license and continues as a community leader and activist. In 1947, she moved from Detroit to Staten Island, starting her career as a nurse's aide at 16 years old, working in the children's ward at Seaview Hospital. She is one of the last living Black Angels, a name given to a group of African American nurses who bravely cared for quarantined tuberculosis patients at Seaview Hospital, which had the largest TB sanitarium in the region. Notably, Seaview is where the first human trials of the treatment for TB were conducted, largely in part due to the work of Black nurses who helped conduct the clinical trial for the drug by administering treatments, observing patients, and reporting results. Ms. Allen and the Black Angels provided care for patients with active TB, a disease that killed 5.6 million US residents between 1900 and 1950, 10,000 of them annually in New York City alone. Ms. Allen was inspired and recruited by her aunt, Edna Sutton Ballard, a surgical nurse and a Black Angel herself. To quote the author of The Black Angels, the untold story of nurses who helped cure tuberculosis, Maria Simelios, the Black Angels remind us that in the darkest of times, there is always light. And in that light stand people like them whose willingness to work under impossible conditions for the greater good restores the humanity in us all. Ms. Allen received a Doctor of Humane Letters, honoris causa, from the College of Staten Island, City University of New York in May 2021. Yes. She has been recognized with several prestigious awards for her outstanding work and legacy, including the Staten Island Advances Women of Achievement Award, New York University's Roy Meyer College of Nursing Helen Manzer Award, and induction into the National Black Nurses Association's Academy of Diversity of Nursing Leaders as a Luminary Fellow. Ms. Allen is a founding member and past president of the National Council of Negro Women, Staten Island Section, the Harriet Tubman Purple Hat Society, and the New York State Women's Staten Island Chapter. She is also an active member of multiple community organizations, including Sandy Ground Historical Society, Weeksville Heritage Center, the Schomburg Center for Research in Black Culture, and the Staten Island Museum. Ms. Allen exemplifies the human connection and understanding that nursing offers to healthcare. She will undoubtedly inspire nurses for generations to come, symbolizing the incredible impact members of our profession can have, even in the direst of circumstances. Virginia, it is wonderful to have the opportunity to shine a spotlight on your career through this award.
Good evening, all. To the Academy, Board of Directors, my fellow honorees, thank you, Dr. Scott. I would like to thank the Academy for presenting me with this prestigious Lifetime Legacy Award. I have dedicated my life to nursing and caring for others, and I am proud to accept this award on behalf of the Black Angels. I have worked beside many incredible nurses throughout my long nursing career, spanning nearly 77 years. Thank you. I live by the quote from Dr. Dorothy Irene Height, "So long as God lets me live here, I want to be of service." And as it was stated before, I started my nursing career at the age of 16 at Seaview Hospital, the largest tuberculosis sanitarium in the world at that time. Seaview is located on the highest point between Maine and Miami. The best treatment available at that time was fresh air, a rich, healthy diet, and plenty of rest. The cure did not come about until 1951 by Dr. Edward Robichek and his team. And if you are familiar with the history of the Black Angels, you will remember that they worked closely with Dr. Robachek before and during the clinical trials, and of course, after the development of the cure. They were the pioneers of the treatment for TB. The Black nurses stepped up to care for the patients at Seaview Hospital. Unfortunately, the Caucasian nurses left because they did not want to become infected with the deadly disease of tuberculosis that had killed millions and is still killing millions each year in the undeveloped countries. My aunt, Edna Sutton Ballard, my maternal aunt, was a registered nurse there. I admired her, and it was my dream to become a nurse. My daughter also pursued a career in nursing, which I think was because of me. I'm hoping that it was. Unfortunately, I lost her to a massive heart attack in 2002. So tonight, I would like to dedicate this award that I'm receiving not only to the Black Angels, but to my Aunt Edna Sutton Ballard and my daughter, Margot Renee Solomon. Thank you so much. I am grateful to be part of this celebration today. And thank you to the Academy for all the good work that you do.
Thank you, Virginia, for your bravery in being a part of one of nursing's most important responses to a public health crisis in the country's history. Before we conclude this evening's award presentation and begin the Living Legends festivities, it is my pleasure to recognize Rosemarie Rizzo Parse as a recipient of this year's Lifetime Legacy Award. Dr. Parse is a world-renowned nurse theorist, currently serving as a visiting scholar and research professor at the State University of New York at Binghamton, Decker College of Nursing and Health Sciences. Throughout her career, Dr. Parse has made outstanding contributions to the discipline and profession of nursing through her progressive leadership in nursing knowledge development, research, education, and practice. She is the founder and current editor of Nursing Science Quarterly, as well as president of Discovery International. As editor, she spearheaded a well-known, highly cited venue for nurse scholars to share and debate matters essential to nursing inquiry and theory development. Reading her recent editorials in Nursing Science Quarterly, it is clear Dr. Parse's zeal for research and advancing nursing theory has not dimmed since developing her landmark theory of human becoming. The model focuses on the patient's perception of their health experiences and encourages nurses to view patients holistically. Within the human becoming paradigm, she has explored the ethics of human dignity and developed teaching, learning, mentoring, leading, following, community, family, and concept inventing models that are widely used. Dr. Parse's human becoming theory has been highly influential across the country. It has served as the basis for policy and rulemaking for the South Dakota State Board of Nursing. It has guided the development of patient-centered medical homes in more than 10 National Committee for Quality Assurance recognized federally qualified health centers across 5 counties in Indiana. The human becoming model has been used to create health policies and emphasize nursing's role in consistent, safe, quality primary care for other patient-centered medical homes. The application of this model supports quality and accessibility through organizations such as the National Association of Community Health Centers, the Association of Clinicians for the Underserved, and the National Health Care for the Homeless Council. Her work has shaped over 100 health policies related to patient-centered care in large healthcare organizations, including the University Health Network and at Sunnybrook and Women's College Health Sciences Center, both which serve over 1 million patients per year. As the founder of the Institute of Human Becoming, each summer she engages in teaching learning with those interested in the paradigm, and all of the 6 models derive from the theory. Dr. Parse's theory has had a global impact. She has been cited over 1,500 times, published 11 books, and written over 250 articles and editorials on the theory. Dr. Parse has made outstanding contributions to the nursing profession through her progressive leadership in nursing knowledge development, research, education, and practice. Dr. Parse continues her work and global educational efforts and could not be with us tonight. Accepting on her behalf is Dr. Mario Ortiz, a colleague and friend.
Thank you so very much. Dr. Parse could not make it tonight, so I'm happy to accept this for her. She sends her deep love and appreciation to the Academy, and she, as many of you have read her theory, it's not quite a quick page turner, so you have to really get into it. So she told me, Mario, keep it short and sweet. So I just want to say on a personal note how proud I was to have the ability to study with a nurse theorist. She gave me a theoretical home, like the other nurse theorists had built a foundation for our discipline and our profession. I was honored to have studied with her. I'm honored to continue to work with her. So she extends her much appreciation, blessings, love, and kindness to all of you. So thank you very much.
Now it is my pleasure to transition our program to the Living Legends celebration. But first, please enjoy dinner. You will notice on the screen the tributes that have been sent in from fellows and colleagues who wish to honor these incredible leaders of our profession. So please enjoy. Thank you very much.